welcome back to our YouTube channel. If you do not recognize Amber, she's our new optician here at 2020 Eye Care. And today we are doing an instructional video on insertion and removal of soft contact lenses. So the very first step in insertion and removal is, of course, to begin with clean hands by washing your hands thoroughly with soap and water. Being sure to clean under your nails as well as your cuticle beds and so on. Amber's already done so we are going to jump right in. So I'm going to have Amber grab her contact lens pack. Good. Go ahead and open the flat pack. Good. So once you open the flat pack, you'll see that your lens is usually at the bottom of the package, hopefully still in the solution. So I'm just gonna have her gently scoop the lens out. Good job. So when you put the lens on your fingertip, if you're right-handed, use your right hand ring finger. You're gonna put the lens bottom side down, bottom side like a bowl, okay? The first thing that I instruct patients to do is to hold the lens at an angle to make sure that the edges are going straight up and not flaring outward, because we don't want the lens to be inside out. Also, you are checking to make sure that there are no tears, debris, anything like that that would make the lens uncomfortable or be harmful to yourself. So Amber's lens looks completely perfect, so we'll go ahead and begin. And what I'll have her do is take her left hand index finger, gently raise her top lid, placing her finger in front of her lashes as close to the lid line as possible. Very good. And we're actually going to, usually you'd start with your right eye, but this is TV, so we're gonna do the left. Now you're going to use your right hand middle finger and bring the bottom lid down. Very good. Gently turn to them so that they can kind of see. Very good. So both fingers are as close to the lid line as possible. Then she can apply a little bit of pressure. Try to blink. And as you see, her right eye will close, her left eye will not. She's got a pretty good grip. We'll go ahead and start because she's kind of watering up. Go ahead and dab a little bit. Good. All right, so go ahead and place your hands back in the same position. Very good. So I'm gonna have her look in the mirror. I'll put this here. Okay. So Amber, what I want you to do is look in the mirror while you do your insertion and follow the lens to your finger, but make sure that you're looking in the mirror. Very good. So she's going right for the center, and she's going between the widest space between the top lid and the bottom lid. Once it's on, let your bottom lid come up, top lid come down, and the reason we do that is to secure the lens. So if you let your bottom lid come up first, it's going to safely secure it from the bottom. If you let your top lid come down next, you safely secure it from the top. Sorry. If you don't do that, you run the risk of blinking too quickly or the lens just falling out completely. Okay? So I would like us to go ahead and do removal, and then we'll maybe revisit insertion. So removal is just as simple as insertion. So hands are in the same place. Go ahead and use your left index finger to pull your top lid up. And I do also want to point out the arch. So Amber, of course, she's done this before, so she can be a little bit lax. For an actual new patient to get a really good grip, you really want an arch. So if your arm's not like this, you don't have a good arch. If you're like this, or like this or that, it's not good. You need the arch. I don't know the physics of it, but you need it. So she's got her arch, good. Right hand, middle finger, bring your bottom lid down, good. She's going to use her thumb and her index finger. She's gonna put one toward each corner of the eye. Good, she's looking up kind of gently. but she still has the middle of the lens that's in her reach. So as she brings her fingers together, she can apply a little bit of pressure and grab the lens. Good, and she did it! And this is actually pretty impressive because this is not the way that Amber usually removes her lenses, and it's not the way that you will either once you're comfortable and you're doing it every day, and you kind of get your own rhythm of doing it. The instructional is just to give you a guide, a start. It's the way that most people will successfully do it. But of course, whichever way you do it, which is safe, is the best way to do it. All right, so now that Amber has removed her lens successfully, it's important to clean it. We always clean our lenses when we take them out and when we insert them. All right, so to clean your lens, I want you to put the lens in your left palm. Good. I want you to cup your palm. Good. And I want you to cover the lens with the solution. And it's important that you use the contact lens solution that your optometrist recommends. And of course, that's a branded solution of their choice based on the health of your eyes. So, all right, so now that she has the lens covered with solution, she's going to use her right index finger pad, which is this, and she's going to rub very gently in the open part of the lens. So her lens is like this. She's rubbing very gently in the center. And when you use the solution, you should be liberal with it. Be very generous. Think of it like soap. You don't want to be stingy with it, okay? You need as much as possible or as much as you're comfortable with so that as you rub, any debris or matter that's on the lens that should not be on the lens will float away, okay? So she's done that. She did a great job. She's going to gently tap in the lens. Very good. And just let that run out. It's clear. You're at home. Let it run in your sink, wherever. Okay, very good. So go ahead and pat your fingertips dry. Very good. Go ahead and grab the lens off the side. Good. Amber's forgetting that she's new. Sorry. All right, so go ahead and put the lens in whichever hand, it doesn't matter because we're actually about to store it. So this is what the inside of the lens looks like. Inside of the case looks like an empty basin. Put the lens in the basin. Good. Editorial Magic will show you what that looks like. And you are just using enough solution to cover the lens. You don't need to fill the entire basin completely with solution because you don't want the lens to float to the surface so that then when you unscrew the cap, it takes a little chunk out of the sag that will eventually lead to a tear. So only enough solution to cover the lens. You want it to have a good soak overnight, whatever your provider, your optometrist has recommended for you. In the morning, when Amber puts her lenses in, she's going to take it out of the case. Good. All right, she's going to clean it because remember, we clean our lenses when we remove them and before we insert them. Very good. She's using a generous amount of solution. Very good. Okay, great. So she's going to put that back on her index finger. She's going to check to see that her lens is the correct way, that it's not inside out. And a convenient way to check if you're not sure how to see on your own is to do the taco test. And with the taco test, she's going to hold that up a little bit, and she's just going to very gently pinch the side, and it should go inward like a taco. Okay, go ahead and turn the lens inside out. Okay, and now when she attempts to do the taco test, it more so like crumbles, almost like I don't know, like a flourless torte falling apart. So there you go, and she'll put that back the right way. Now, if you've had to handle it that much, I would actually advise that you give it another good rinse. You want to remember that, any oils or lotions or whatever that you have on your hands still run the risk of transferring to your lens. So just give it a good rinse. Yeah, and a lot of exposure kind of dries it out as well. You're very welcome.
Perfect.
And one little tidbit also, before you start your insertion and removal, until you're confident in your skills, you may want to just put a paper towel on your sink or in your sink so that if your lens does fall out, you know where it's gone. Okay, so Amber's going to put that in. She's great. She knows how to wear lenses. She's going to remember that as a new wearer, if she experiences any discomfort, irritation, redness, soreness, that she's going to contact her contact lens provider, her optometrist, as quickly as possible and notify them, because we do not wear contacts when they are ripped, torn, old, expired. We want her to be a compliant patient as you. Also, it's very important that you discard the solution that's in your case, that you rinse it with water, let it air dry with the caps off, so that should be a part of your morning routine. Just the same as in the evening time, when you store your lenses, you are using fresh solution to store your lenses. I also like to remind patients to completely discard the case when you get a new bottle. That's the best way to keep it in your memory. When you get a new bottle of solution, you should also be getting a new case. You should not be having the same case for months and years at a time. So when you go to use a solution, just make sure that when you go to squeeze the bottle, it's not touching the contact lens and it's not touching your hand. Again, as sterile as possible is the best way to keep your lens clean, which is therefore the best way to keep your eyes clean. When you're not using the solution, make sure that you are keeping the case, the cap, on the bottle, okay? Try not to leave that exposed. You don't want any contaminants. Just some small reminders. One, be very patient with yourself. Your reflexes are very strong. You're not used to putting something in your eyes. It's your eyes' job to close and to keep foreign objects out of them. So relax. I advise all my patients, do not hold your breath when you're doing this. When you hold your breath, it tends to make you more tense. Try to be relaxed. And most importantly, make sure that you are being compliant with the wearing schedule that your doctor has recommended to you. So if your lens is a 2-week lens, that's it. 2 weeks, not 14 uses, 2 weeks. If your lens is a monthly lens, 30 days, not 30 uses. All right, if your lens is a daily lens, you want to make sure that you're removing it and discarding it daily. So 1 insertion, 1 removal, trash it. All right. I do also want to encourage people to be compliant with their routine exams. Every state is different. In our lovely state of Ohio, contact lens prescriptions are good for 1 year. So we're not trying to dance around that in any way. Even if your vision is great, the health of your eyes is what you're trying to preserve. You want to see well and you want your eyes to be healthy as well. So please make sure that you're keeping those annual exams for your contact lenses, that we are sticking to the wear time recommended by our doctors, and that we are replacing them as necessary. In the event that it needs to be said, that we are also not sharing our contacts. Our contacts are for whom they are prescribed for and not who we want to share them with. Well, thank you all for tuning into this video. I hope it's been very helpful for instructing you on insertion and removal. If you have any questions that you would like to direct our way, please leave them in the comments. We're going to do our best to address all of those. Or if you all have any suggestions on material that you would like to see, we would love to know that as well, so that we can make that available to you all. Thank you so much. Bye.